Only 0.14% of men actually have a medical condition called micropenis, yet 55% think they're too small. This dangerous gap is pushing men toward risky procedures with devastating consequences. I'm Dr. Elizabeth Rains, urologist, and today I'm exposing the truth about penis enlargement, the one technique with real evidence. And the surgeries you should never consider. Did you know a survey of 50,000 heterosexual men revealed that over half, about 55%, were unhappy with the size or appearance of their penis? Interestingly, when researchers asked their partners, 85% of women said they were satisfied with how their partner looked. Still, at the end of the day, what truly matters is how a man feels about his own body. Part of the problem is that pornography has distorted perceptions of what's normal. In reality, the average erect penile length across studies is about 5.2 inches or 13.2 centimeters. Sizes that fall within about 2.5 standard deviations of this mean are considered normal, whether slightly longer or shorter. A penis length below 2.9 inches or 7.5 centimeters is classified as a micropenis, a condition affecting just 0.14% of the population. Though rare, it can result from congenital or hormonal issues, prior surgery, or cancer treatment. But for today's discussion, let's focus on men whose size actually falls within the normal range. The reality is that most men who worry about being too small are well within average measurements. The real challenge is psychological. A large number of men struggle with distress over the belief that their penis isn't long enough, even when it is. This condition is sometimes described as a form of body dysmorphic disorder, and it even has a name: small penis anxiety. It doesn't mean the penis is abnormally small. It means the man feels preoccupied with the idea that it is. For some, this fixation consumes more than an hour each day, interfering with work, relationships, and daily activities. In severe cases, it can lead to hospitalization or even thoughts of suicide. This is no laughing matter. It's a serious men's health issue that deserves attention. Another major challenge is misinformation. A quick internet search on how to make your penis longer brings up countless websites and so-called treatments, many of which are unreliable or outright unsafe. Some men even travel abroad or turn to unlicensed providers, exposing themselves to risky procedures with potentially serious consequences. Please avoid that path. Always seek guidance from a qualified urologist or psychologist who can provide safe, evidence-based care. Before going further, it's important to note the official stance from the Sexual Medicine Society of North America. Procedures aimed at increasing penile length or girth are not recommended and are considered experimental, except in cases of true micropenis. The approaches I'm about to discuss are mentioned in urology literature and have some supporting data, but they are not standard treatments. And before considering any of them, it's essential to consult with a urologist experienced in this area. For transparency, I don't perform or offer penile lengthening procedures in my own practice, but since it's such an important and frequently asked topic, I've reviewed the available research for you. Let's start with non-surgical approaches. The first, and often most effective, is psychological counseling. Using validated tools and therapy, many men come to understand what normal size truly means and learn to manage the anxiety surrounding it. In fact, studies show that after counseling alone, the majority no longer seek any form of lengthening treatment, surgical or otherwise. Beyond counseling, three non-surgical options are often discussed: penile extenders, vacuum erection devices, and injectable treatments. Of these, only extenders have solid evidence for producing measurable results. These devices apply gentle, consistent traction over many hours each day, typically for several months. In committed users, studies found a modest length increase of around 2 centimeters. However, the process requires strict discipline and patience. Side effects like numbness, bruising, or simply no meaningful gain are possible. Vacuum devices, while useful for erections, do not increase length. As for penile injections, various substances have been tried, but the risks are high, ranging from scarring to severe complications that can appear even decades later. For that reason, injections are strongly discouraged. Now let's talk about surgical options. Several procedures have been described in the medical literature, the most common being the release of the suspensory ligament that anchors the penis to the pubic bone. By cutting this ligament, a small increase in visible length can sometimes be achieved. Other techniques involve tissue flaps, grafts, or even rib cartilage. The problem is that outcomes are generally poor. Complication rates are high, satisfaction is low, and the quality of published studies is weak. Because of these risks, surgery for penile lengthening should never be pursued outside of a carefully monitored clinical trial. In such trials, an ethics board ensures patient safety, tracks complications, and publishes transparent results. Without that oversight, the chances of ending up with disappointing or even harmful outcomes are simply too great. So here's the bottom line: there isn't much you can do to dramatically change the length you were born with. Penile traction devices can produce a small gain, but results are modest at best. Most other methods are still experimental, risky, or simply ineffective. The most important step for many men is addressing the anxiety itself through professional counseling before considering anything invasive. That way, you avoid the danger of pursuing procedures that may leave you worse off, disfigured, less functional, and deeply regretful. Here's the bottom line: most men who worry about their size are actually well within the normal range, and the majority of so called miracle methods are either ineffective or downright risky. The only approach with solid scientific backing is consistent use of a penile extender, and even then, the results are modest. The most important thing is not to let anxiety push you toward dangerous procedures that can do far more harm than good. If this video helped clear things up or taught you something new, make sure to subscribe to Urology for Men, your source for honest, evidence based men's health advice every week. And I'd love to hear from you in the comments. Have you ever had concerns about this or tried any of these methods yourself? Your questions and stories help other men see they're not alone and can make smarter choices for their health. Take care of yourself. You deserve it. See you in the next video.